I'm Gary Nickerson,
And I'm Quinn Taggart.
and this is Outside My Window. We have two guests with us in this segment. We're going to talk about the Tri-County VON. Sandra Hubbard-LeBlanc is the Program Coordinator for Community Support Services. Anna Muro is a volunteer member of the Tri-County Community Corporation and has been on the board as a volunteer for a year. She now serves as Chair of Fund Development. Ladies, thank you very much for joining Quinn and I today.
Certainly our pleasure. Thank you. Thank you, Gary and Quinn.
You're very welcome. Sandra, I want to start with you. Give us a bit of history of the VON. The organization nationally has been around for many, many years, and it's been in the Tri-Counties for certainly as long as I can remember.
Oh, it goes way beyond our time, Gary. VON started way back in the late 1890s, and it was brought about by the wife of the then Governor General, Lady Ishbel Aberdeen, who actually saw a need in rural areas to provide health services in remote areas that had a lack of health services. And then shortly after that, if you recall, we had, the Halifax explosion and things like that. And VON were just so instrumental in providing nursing services within the communities to help fill gaps in areas that didn't have doctors, nurses, and other such things that we take for granted today. So our vision, if we fast forward from the 1890s to today, VON's vision is every life lived to the fullest, and we really do believe in that. If the services we provide are holistic and geared to filling gaps in areas where perhaps there are services missing. Our values definitely speak well to respect, compassion, and excellence, and that's within every area that we serve. Most people know VON, recognize VON as a nursing organization. The general public's view is that it is a nursing organization, and they would be correct to absolutely see that. The other hidden components, however, are home care. So some people are familiar with people going into homes, perhaps to tuck somebody into a bed, to prepare meals, to do some light house cleaning. Those are things that VON can provide as well, out in areas where there are no other groups providing that type of service. But the often less known part of VON, and that's why Anne and I are here today, and we're so thrilled that you invited us to be on the show, is to discuss the community support services aspect of the Victorian Order of Nurses. And here in Tri-County, Digby, Shelburne, Yarmouth, we have several programs such as Meals on Wheels, transportation programs for seniors and folks with disabilities, adult day programs for dependent adults and persons with dementia. Those types of services are often unknown by general population, and they are supported less by finances from the government. So when you think of VON and you realize the nursing aspect of it, the Department of Health of the province of Nova Scotia financially supports the nursing aspect. We do get some funding for our community support services, but that's why we do the big part of grassroots funding to support all of the programs that keep people living in their homes longer, living more independently, and receiving services. So some of those services, I will back up here though, Gary. Some of the grassroots funding we have had in the past, prior to COVID-19, were things like our walkathon that many people, brought their dogs and their kids and hit the road to raise money for VON, and that was a big hit. Our chocolate lunch that happened in February with the Roppy pie and all the chocolate desserts you could eat was also a big hit, and I was a big hit, and I was in the lineup there too for the chocolate, for sure. All of us were. For sure. And then in August, we'd always have a surf or turf event in the big tent behind Rudders. All of those have been tremendously impacted by COVID, and, the people who are listening today know why. You just can't congregate in groups. So we've had to try to rethink, okay, how can we raise funds to support these services in the Tri-County? So a few, we still are providing our programs. We're happy to say we follow strict Nova Scotia government protocols and COVID-19 protocols so that, all of our programs are trying their best to stay up and running despite lack of funds right now. But some of our programs, actually, we do have a frozen Meals on Wheels program, which we started up in last March. It's been just over a year when that program began, and it began when COVID hit. We realized that there was a sudden need for many people who couldn't get out. So there was getting some nutrition into homes became a very important thing to do. So we started that program up.
If I could interfere here just for a moment, Sandra,
absolutely.
Those Meals on Wheels are excellent, and I had the opportunity to test them out. I thought, I can't really go around saying how great it is before I try it.
Right.
And I did it for a week, and I thought, wow, this is excellent. They were tasty, they were filling, they were nutritious, and it was so easy.
Oh, good.
Yes.
Thanks, Anne. I'm glad you liked them. I've eaten some too, and I have my favorites, I must say.
Yes.
So the Frozen Meals on Wheels program, of course, the meals are frozen. They're not hot meals coming to your door, but they are nutritionally based. It's not your typical, frozen dinner that you may buy in a grocery store. Those are yummy, but these are more nutritionally focused with, looking at low salt, low sugar, diabetic, renal, requirements for meals. We can certainly look into delivering and assisting our clients with those requirements. We deliver weekly right to your door. We have a contactless delivery system, so we're keeping everybody safe. The meals are $5 each, and the delivery right now is free during COVID, and we have volunteers who are delivering those meals right through from Digby right through to as far as Lockport right now.
Sandra, if I can interrupt you for a second there and just kind of highlight a bit on the volunteer side of things. So I know you were negatively affected when COVID came in at the beginning, with your volunteer base. Certainly a lot of your volunteers would have been in the age group or target audience for COVID infection. So how has that evolved over time? Are you back up to speed when it comes to your volunteer base?
What a great question. We are not back up to speed. I have several volunteers who, specifically because of their age, didn't want to provide, like when we're talking about transportation services and that close contact of having a client in a vehicle with them. Understandably so, they pulled from the program until things get back to normal. So the volunteers I still have in my database, some are starting to come out and about more. But we can always use more volunteers. I have more needs sometimes than I do have volunteers. So, and the volunteers who are working, we provide them with the face masks, we provide them with everything they need, the necessary training, so that they can provide a top-notch health service during this pandemic. So that was a great question. Thanks for asking that.
And you're, as we mentioned, chair of fund development. That's got to be a huge challenge post-COVID.
Well, my initial reaction to that question is I accepted a role as fund development, and it hasn't been fun.
Sure, it hasn't.
That's my first thing, because a lot of the programs that we had in place and that I'm taking over from somebody who was very successful at all of these have not been able to be brought to fruition. So we're going along in a different line at this time and hoping that we will be successful. Now, I'll keep that until a little bit later in the program, if you don't mind.
No, we don't
That
mind at
is,
all. I've certainly seen in the seniors apartment where I live here in Yarmouth County, a number of the tenants are clients of the VON. So I see the nurses come and go on a daily basis outside my window, no pun intended. And I know how important they are to their clients or to their patients, beyond just the sort of the health care needs and the daily needs. That companionship for whatever length of time that the VON nurse may be there is very, very important. Can you speak to that?
I can attest to that one on a personal level, if you will. My husband had nursing care in our home for 2 years. And this is the main reason why I got interested in VON. It's my big reason for wanting to give back to an organization that has given us so much and who gives so much to our community as a whole. This is I think we heard that the VON nursing program was most recently described as an invisible army. And if you agree, that's quite a good cover name for them. Those nurses and all the other care people that came connected with VON, all the things that they directed us to do and helped us to find other services that we needed during his illness. And he looked forward to those nurses. He said his girls were coming, at what time they were coming. He knew them by name. And if he met them out in the community while he was still able to be out and about, he was very glad to just see them on a friendly basis. You're absolutely right. That service is not just their bedside manner, their openness to helping us in our homes and in our personal lives is just, I can't be described. Anybody that has experienced it can certainly attest to that.
Mm. And it falls along that same line with our volunteers who are delivering meals or transporting clients to doctor's appointments. They all, often we have so many comments, that it's not just dropping off a meal. They'll keep the 6-foot distance, but still have a chat for 5 minutes, because often that's the one and only person they've seen all week. So, we touch lives in many, many ways, for sure. If you don't mind, I'll just keep on going to explain some other programs that we have. And one is, we're very, and it looks like
I have a question. I'm not quite sure the answer of this. I'm relatively new to the organization. So I don't know, does every community corporation have these same services programs?
So there are 10 VON sites throughout Nova Scotia, and every site generally tries to have the same type of program. Some have more, some have less.
Okay.
So that was a great question.
Thank you.
Yeah, you're welcome. So the assisted transportation program we're very proud of. This is an assisted and accompanied transportation that we provide to seniors with a frailty or a physical restriction that would make their activities of daily living, like shopping or banking or even attending a doctor's appointment, it would make it challenging for that individual. Perhaps they're living with a visual impairment and they need a sighted guide to take them grocery shopping, that type of thing. It goes beyond just a taxi service. Taxis are great, but when you need a physical arm or somebody to accompany you to make sure you can get things done, that's what VON is able to provide.
And those are all volunteer services.
All volunteer services. I coordinate. I need to do an assessment on clients to see if they qualify for the program. But it is all volunteers that are taking their time and their vehicles and transporting people to different places. There is a fee for the service, and it varies upon where that person would live and how far they're traveling. But some impacts, some actual impacts, the stories I hear from the let's say the transportation program. One, I have clients who are very elderly, and their adult children would typically maybe be able to bring them to their appointment, but they need to work. So we're living in a sandwich generation. So I did have one client say, well, I don't need to bother my daughter anymore to take me to the doctor's appointment in the daytime.
Yes.
And she's calling me, and we have a nice chat, and we book the appointment, and then she's spending time with this person in a vehicle. So it really is a win-win. And getting back to what we were just saying about that connectivity, the connection that people have. One client said the volunteer is so helpful to me, and I love our little talks. Mm-hmm. So it really is a great service in more than just providing a ride and assistance.
Yes, and you mentioned that there was a cost there. However, as in the meals program and the traveling and everything else that's connected to our VON services, when people are truly in need, the cost can be taken away.
Yeah,
and we can help people at whatever level that their needs require.
Exactly, and that's why the fundraising is so.
That's right.
It's so pertinent because all of that affects what we can provide. And yes, I do have some clients who need that financial assistance. So we would waive a fee. Of course, they would have to speak to me, and I get managerial approval. But yes, absolutely, we're not going to refuse people because they can't afford the service. Mm-hmm. Which is the other wonderful side to Victorian Order of Nurses, for sure. Another program that maybe some people are more aware of, may have heard it in the news or whatever, is our Adult Day program. This has been impacted by COVID. We used to meet Thursdays. We had 2 programs, one in the morning, one in the afternoon. It would occur at the Hope Center in Yarmouth, but we can no longer meet in congregate form. So it's been revamped, and it's all been cleared by Dr. Strang and what have you. So we meet the requirements, and we're currently providing one-on-one at the Hope Center or in your home.
Yes, in your home sounds excellent.
It is, yeah. So this is for dependent adults, people with dementia, somebody who requires some extra assistance, and the caregiver can't be with them. This is the program for that type of thing. The other part to this, which is a big part of where my heart goes, is to the caregivers. People are with loved ones, caring for parents, caring for spouses, caring for whomever. They're with that person, and you know this from when it's 24/7. Mm-hmm. And sometimes a person just needs a break.
Yes, and those nurses, when they came in, they were going to be here for an hour. I had an hour to take a shower or run to the store and pick up some bread or do whatever. So that service, no matter which level it's on, it's invaluable.
Exactly. So it gives the person a breather.
Mm-hmm.
So it is a respite service as well for caregivers who need time just sit and read a book. Mm-hmm. Some people would just drop off their loved one and then go home and take a nap. Mm-hmm. And that was the only 2 hours they had in a week. So we're very proud of our Adult Day programs. They are client-centered. We offer recreational opportunities, social interaction, music, singing, stories. We even it's a holistic program because we offer gentle exercise, art, nutrition, and all of that. And people just love the program. And the clients who are signed up for the one that was congregate, they're really missing it. So hopefully this pandemic can soon be a thing of the past and we can meet face-to-face again for those who are missing their buddies.
We're certainly all missing face-to-face anything, even our meetings, our VON meetings that are done on Zoom. We see faces, but we're missing our physical contact and physical presence with the people we work with.
For sure. When I think back to the Adult Day program, and I used to coordinate that program, and I think back to some special clients who were with me. One gentleman who is well known in the community, he's since passed away, but he loved the program, and he was living with the dementia. And the program, he actually, when I first signed him up for the program, didn't want to attend, and his wife convinced him, you should try it. And so the first week he was at the program, he had a ball, and he decided to stay. And he did stay for many months, years actually, until he passed away. But at one of the meetings we had, he asked to meet me privately, and so I took him into a little corner area, and he told me he needed to thank me for making him come to the program, that he loved it, and that it made him feel important again.
Yes.
So the impact, it's immeasurable, the impact we had in his life. His wife was getting a well-deserved couple of hours off, and he was being fed right down to the soul in many ways.
Yes.
And, because we would just give him tasks to do,
Yes.
Why don't you pass the donuts around? Why don't you be the greeter today? And it just made him feel so important.
Yes.
So these are the types of programs that VON Community Support Services have, and that are out there in the community. One other program that I'll just touch briefly on, and it has been impacted. We have not met since last March, and it's our caregiver support group that would happen once a month. And that was for anybody caring for anybody in home or somebody who is placed in long-term care. Even if we place a loved one in long-term care, it doesn't mean that we stop being a caregiver. It just changes the face of what that caregiver looks like. And it's sometimes a positive thing, sometimes a very difficult thing for a caregiver to go through.
Mm-hmm.
Anyway, our caregiver support really provided one-on-one, sometimes support. You're receiving support from peers who are going through very same issues. We provide education, help caregivers, perhaps who weren't used to the whole health system, how it all works with continuing care, with different aspects of how to get through this journey and who you need to talk to at what point in the journey. We're hoping to be able to start that up again because it is a very important thing, but we can't meet face to face. So that's a challenge on its own. Yeah, so go ahead, sorry.
One is just amazed, as I am any time I've spoken with you folks, is the number and quality of the support services that the VON provides. I mean, it truly is a part of the backbone of our healthcare system, providing services that are not otherwise provided, and again to stress how important the volunteers are and how important fundraising is. As we mentioned earlier, one of the long-standing and probably best known is the what used to be the annual walkathon. And I think you had a chocolate lunch. Was it the chocolate lunch? Yeah.
Yes, with Ralphie pie and all kinds of chocolate.
Yes, I remember that was Raising's favorite thing to cover. He liked the chocolate.
Yeah.
But, that brought out so many people, and you could see the support from the community. The VON Tri-County also did some fundraisers during the summer on the waterfront. So now here we are. We're still faced, as you mentioned, with some COVID restrictions. It's deeply affecting fundraising. So what do you do now?
Well, we're really excited about the opening of our new fundraiser, and we are proud to say that we're joining Rafflebox online with a 50-50 draw to support our VON across Nova Scotia. Tickets will go on sale on Thursday, April 15th. The tickets will go for $1 for $5, $3 for $10, $20 for $20, and $100 for $50. That keeps us very competitive with the other sites that are on there and the other agencies that are using the 50-50 draw with Rafflebox.
Not everyone knows that VON is it's a registered charity, and community support services programs requires grassroots funding to provide client services. So all the things that Sandra mentioned, of those, we support those financially through the year, and COVID made it difficult, if not impossible, on most of the levels. The 50-50 support will be done in all 10 VON sites across Nova Scotia. So in each site, we have a drop down that allows the people that are participating to choose the site where they want the funds that they are providing to go to. So if you buy a ticket here in Yarmouth or in McKagan or in any of parts of the Tri-County, and you drop box for the Tri-County, the funds from that portion that will go to VON will be allocated to the community corporation where it is. And we're really excited about this. We have most of the sites on board at this time, and we're not finished setting completely with our setup yet.
So if I could just jump in.
Sure.
Here. So this is actually going to take part, the 50-50 draw is actually through the raffle box that is being so popular for the fire departments, local fire departments. So it is a website that folks would
Yes.
go online, find raffle box, and then the VON fundraiser through raffle box. And then from there, once they purchase tickets, they just like with the fire department, you choose what VON site you wish to support. So the money coming in, wherever you choose, then supports that area, and the programs is specific to that area.
And we feel that's really important because a lot of our fundraising in the past, if you bought the dinner for the chocolate lunch and you paid $10, you knew that $10 was staying here. And all the other fundraising that we did have, you knew it was to support our local community and the needs here. And the greatest needs for anything from nursing equipment to supporting our meals or the transportation or the adult day program. And those people that I said, well, maybe they can't afford a meal or they haven't got $10 to pay for their transportation or $4 or whatever the cost might be at the time. It helps us to continue to deliver these meals and to offer subsidies. For example, the meals actually cost more than what they're being sold for by VON. So we subsidize those to make them cost less. And we help to buy crafts for the adult day program, and know that all the money raised will go back to the services we offer in this community. That can't be emphasized enough because people often say, well, I went online and how will I know? Well, there is a drop box. You choose it yourself, and that's where the funds will go. Is there anything else on that, Sandra, that you feel might be...
No, you covered the raffle box very well, for sure. One of our other ways of fundraising is our annual mail out that used to come and still does come for VON Tri-County. But while I have this opportunity, some people are getting letters in their mail, and the address is from Ottawa. Just to make people aware that even though that letter is coming from the Ottawa area, that is where our VON national office is. And we since determined that it is financially better, more feasible for us to get the VON national office to send out the annual mail-out letter asking for some fundraising, asking for people to support us, mail in their donations. That still comes to Tri-County, even though the address on the envelope says Ottawa. We've had a few calls. We've had a few people who are concerned, and rightfully so. We so understand that, we're working hard. We want to support the organizations that are dear to our hearts. And because we're working so hard to do our own living, we want to make sure that wherever we're putting our money is staying in the community and supporting the people that we know, that we live with. So just an update there, I'd like people to know it does stay in our area.
I'm glad you brought that up because it was one of the areas where there was a bit of confusion in our people that were wanting to donate. So we want to really, really encourage everybody to support VON through this raffle box draw. We expect big pots because there are 10 community corporations participating. So if it was just the Tri-Counties, it might be a smaller pot and not as lucrative. This way, there may be some substantial winnings for anybody that would like to buy a ticket. And the tickets are very, very reasonable. We're going to be running the raffle right here in Yarmouth, so we'll know that we're in charge of this raffle box thing for the community corporations for VON. So we will be taking care of it here. And if anybody has any questions, we will be more than happy to help them to figure it out or to answer anything that they have concerning services that Sandra went over, all the things that are available for VON, and our fundraising. And I think that more or less covers it, unless you have any questions, Gary.
Well, I think I just want to jump in for a second if I can and say that this is great. I think that, as time evolves, people and organizations have to evolve their fundraising activities as well to kind of suit the conditions we're in. And I think that certainly the 50-50 stuff has been very popular in the last little while. However, is this a substitution for some of your other fundraising activities, or will we still see some of the other activities pop back up if COVID restrictions change?
Oh, well, we're just anxious for everybody to be vaccinated and free to be, and we certainly plan on more chocolate lunches and surf and turf on the wharf and walks if we can, and anything else that we might come up with. Most certainly, Quinn, we are looking forward to all the activities that we can have. We can't do too much for fundraising for this great organization.
And to just add to what Anne said, when you look outside your window, you see faces, but many of those faces, I think a large percentage of those faces would have had been personally touched by VON in some way or known somebody who's been personally touched by services that VON nurses or volunteers or other staff members are providing. We are a caring institution, a caring charity, and we just want to keep going for another, whatever it's been, 100 and since the late 1890s. We hope we can keep things running, and fundraising is the way that one of the only ways that will keep us focused on providing what people need.
If you think about the amount of money that VON saves our community, for example, in those 2 years that my husband was sick, he didn't spend that time in the hospital. He didn't spend that time being cared for by physicians. And he was cared for in our home, which we pay for. He was cared for by VON, which didn't charge us anything. And we were so happy to be able to be at home so that between nursing care, between the medical assistance that he needed, that we were able to watch a TV program and share a meal and be at home. So there's nothing, it's really quite a community benefit to have VON here with us, since we in Nova Scotia and Ontario are the only two provinces that still have VON. I think we have to work hard to keep it here, especially with all of our cancer and our COVID and our Lyme disease and dementia and everything else that happens to affect our families for their medical needs here in Nova Scotia.
With all the programs and activities that you're operating right now, is there a particular need that you see on the horizon as something that you're going to try to attack over the next little while? Maybe attack's the wrong word, but to try to cover or fill a gap?
My opinion, my answer to that would be to enhance the existing programs as much as we can, to have more volunteers for Sandra's programs, to have more money, to be able maybe to never charge anything to anybody for any of those services. Wouldn't that be awesome? I don't know, Sandra, have you got any programs in particular that you'd like to
Nothing
grow?
specific, but we're always looking to grow programs.
Yes.
We don't want to lose programs. That's the last thing we want to do, but always looking for growth. And we do have, at the national level, and it trickles right down to the local community corporations, otherwise known as boards of directors. The focus is always on strategic plans. What is happening? We're looking at the social determinants of health, which are more than just, putting a nurse in a home. When you look at the social determinants of health, and, that means right down to income coming in and how that impacts health and how that impacts nutrition and housing and so forth. So our strategic plans are always being looked at and studied and try to determine where the gaps are and can we provide a service. We're never looking to compete with any service out there. We're always looking to to fill a gap. That is our focus. And I guess, with what Anne said, again, when I go back to the vision of every life lived to the fullest, I love that vision because we offer services across VON from birth to death. And every life matters, no matter who you are, no matter what color your skin is, no matter your ethnicity, your religious beliefs, whatever. We aim to make every life try to live to the fullest. Whether you're palliative care, you still have that right to that breath until you can't take it anymore.
For sure.
And so we provide the hand to get you through. So that's what these fundraisers support.
And some of these programs, by the way, have come up because we had a meeting, and at that meeting, we said we used to have meals. And Sandra said, I think we can do that again, and I'll look into it. And here we are providing meals for people, and people that needed meals, that are hungry. There's lots of organizations supporting those things, and we're just part of it. We're not everything. We're not all to everybody, but we do provide that, like Sandra says, we fill in the cracks where maybe some of the bigger organizations or the other organizations cannot provide it all.
Yeah, we go places where perhaps a hot Meals on Wheels service isn't provided, isn't available. I've had one client I can think of, this is a few years back, before we had the meals. But we have a lot of people living with dementia in their homes, and a lot of caregivers worrying, is Dad eating? And if he is, what is he eating? And I know of one gentleman, this is a few years back, who was eating dog food because he didn't have the wherewithal to realize that that's what he was eating. Had we had frozen meals back then, we would have had meals in his freezer, and the daughter would have been less worried. And anyway, we're here now, and it's all good.
Yes, and we're looking forward to this and hoping that the community will come out with the support and enthusiasm that we have for the program that we're initiating here today. And we thank you so much for promoting it with us and helping us to support this valuable service.
And we hope you'll buy tickets.
Yeah, lots of them.
Absolutely, and we hope everyone does. We hope everyone in any way will support the VON in their community. In this case, the Tri-County VON, and we hope you can increase that database of volunteers whom are so critical in putting out those support services to those in need in our community. Ladies, thank you so much. It's been a pleasure, and we can't wait to hear the success of the 50/50 venture.
Thank you, Gary. If you don't mind, I could give my contact information if anybody would like to ask questions about our program, about the fundraisers, what have you. They can reach me by email at sandra.hubbard-leblanc@von.ca. And my direct phone number, 902-742-4512, extension 234. And I'd be happy to speak with anyone about anything.
Absolutely. We certainly will have that up on the screen as well as through the audio as well as you said it. One last little thing is that as we air this, it's now Volunteer Month. So what would you have to say for your volunteers? What would you like to say to them?
I would love to say I can't thank those enough who are volunteering their time and their energy and taking time away from their own families during a pandemic to provide support to clients in their area. I've been told by clients that the volunteers we have are angels, and I really believe that. We couldn't run our programs the way we are if we didn't have volunteers. So there are no words significant enough to express my appreciation for them. And happy Volunteers Month, actually,
That's
to
perfect.
everybody. We celebrate our volunteers. We try every year to have a nice award banquet and what have you. It's nowhere near enough to thank them for what they do.
If I can, that banquet that I attended, the first one that I attended was before COVID, and I was new to the organization, new to the board, and I was so impressed with all of the services, and they were giving out pins for people and certificates for people that have been volunteering for 20 years and 25 years. I was so pleased this year. I got a 1-year pin. I was excited. But you know what? There's a start. You have to start somewhere, and 1 year can be 20. I'm planning on hanging in there. And I appreciate all of the support that Sandra and the office give to the volunteers that work. That's why everybody is so successful in doing the jobs required. Thank you.
Excellent.
Thank you both very much. We've been speaking with Sandra Hubbard-LeBlanc and Anna Muro of the VON Tri-County. I'm Gary Nickerson.
And I'm Quinn Taggart.
And this has been Outside My Window.